Hello, my name is Dr. Dewan S. Raja. Today I will discuss about upper motor neuron and lower motor neuron lesions, their differences. So what are the upper motor neurons? These are the neurons of the cerebral cortex extending from the cerebral cortex to the brain stem. We call them corticobulbar neurons. Or from the cerebral cortex to the anterior horns of the spinal cord, we have called them corticospinal neurons. So, upper motor neurons are mostly located in the cerebral cortex. It is also located in the brain stem. Upper motor neurons also include brainstem nuclei that influence the lower motor neuron, that is lateral vestibular nucleus, red nucleus, reticular nucleus. So what is upper motor neuron lesion? How this happen? That is caused by damage to the neuron or their axons that innervate the lower motor neuron. So any lesion from the cerebral cortex to the lower motor neuron at the anterior gray horn or to the cranial nerve nuclei in the brainstem, the cell body of the neuron or the axon is damaged, then there will be upper motor neuron lesion. Okay, so this is the picture of upper motor neuron from the cerebral cortex. Suppose this is the corticospinal neurons. It forms a tract, the axon forms a tract. So this is the cerebral cortex. It goes through the internal capsule. This is the internal capsule area. This is the upper motor neuron up to this level. Okay, so from the cerebral cortex to the spinal cord, so it is corticospinal descending fiber. So this is an example of the this is one of the example of the upper motor neuron. What is the lower motor neuron? From the anterior gray horn, it is going to the muscle. So from here to here, lower motor neuron, this to this is the upper motor neuron. But some upper motor neuron end up in the brain stem, and some upper motor neuron present in the brain stem also, like that of the red nucleus, the reticular nucleus, even the part of the vestibular nucleus. So this is a cranial nerve, seventh cranial nerve. It is the supranuclear part, that is the upper motor neuron part, and the infranuclear part, lower motor neuron part. So if the lower motor neuron lesion, facial nerve lesion, then we will have entire side of the face, the same side of section will be damaged. In case of lesion to the supranuclear region, what will happen? Supranuclear region lesion, then contralateral side, face, lower two-thirds will be paralyzed, upper part will be spared. So features of upper motor neuron lesion. We have acute stage, chronic stage. Acute stage, there will be transient spinal shock characterized by flaccid paralysis, areflexia, hypotonia. Chronic stage lesion, spastic paralysis, hypertonia with increased tension in the anti-gravity muscle, okay, like the flexor muscles of the arm, extensor muscles of the leg and the knee, loss of abdominal reflexes, loss of premascular reflex in the male, and positive Babinski sign. So the finger toe will go up. Okay, there will be dorsiflexion. Clonus, that will be rhythmic contraction of the muscle due to sudden stretching. These are the features of the chronic stage of upper motor neuron lesion. So lower motor neuron lesion. What are the lower motor neurons? First of all, let's get that. The lower motor neuron extend from the anterior horn cell to the skeletal muscle. The lower motor neuron also include the motor nuclei of the third, fourth, fifth, sixth, seventh, eighth, 9, 10, 11, and 12 cranial nerve. Okay, we don't include the optic and olfactory nerve. Those two are the sensory nerve. We are dealing with the motor nerves or mixed nerves. Okay. So what are the features of lower motor neuron lesion? Flaccid paralysis, areflexia, muscle atrophy, fasciculation, group of muscle fiber will be contract, and it is visible over the from the skin over the skin. So group a fascicle contraction. So the fascicle contraction, fibrillation, individual muscle fiber contraction that should be checked by the electromyography. So what are the differences between upper and lower motor neuron in terms of lesion? If we go there, okay, we'll find out muscle tone in upper motor neuron, increased tone, spastic muscle. Why it is spastic? Because lower motor neuron should regulate the upper motor neuron also partly. So if there is upper motor neuron lesion, lower motor neuron lesion has no action, so there will be spastic muscle feature in upper motor neuron. Here lower motor neuron flaccid muscle. Here upper motor and lower motor is disconnected, a particular nerve is cut, then there will be flaccid muscle, decreased tone, possibility of contracture. Muscle atrophy, little or no atrophy, but muscle strength is decreased. Lower motor neuron lesion, atrophy, wasting, and loss of muscle strength. Reflexes, upper motor neuron, remember, upper means everything up. So hyperreflexia, increased tone. Okay. So here, areflexia, lower motor neuron, and fasciculation may be present, but as a whole tone is decreased in this person. So fasciculation is a feature of lower motor neuron lesion, not upper motor neuron lesion. Location of the lesion is very important. Location above the medulla oblongata, contralateral loss of muscle actions. Lesion below the medulla oblongata, ipsilateral loss of muscle action. In case of lower motor neuron lesion, same side loss of muscular actions. Fibrillation, individual muscle fiber contraction, upper motor neuron lesion absent, lower motor neuron lesion present. It should only be checked by an electromyography. Pronus, rhythmic contraction of the tendons. This happens due to sudden stretching. In upper motor neuron, it is present. In lower motor neuron lesion, it is absent. So in upper motor neuron lesion, it is present. So we have some note now, note like that. We have gone through in our previous video amyotrophic lateral sclerosis, also called Lou Gehrig disease. He was a great baseball player. This is a disease of the upper and lower motor neuron with very fatal outcome. Poliomyelitis, onset very much disturbing disease. Now it has been gone because of vaccine. Poliomyelitis is a disease of the lower motor neuron, specifically anterior gray horn neurons are damaged by poliomyelitis. Facial nerve palsy, upper motor neuron lesion. We have seen the image. Contralateral lower two-thirds of facial paralysis, lower motor neuron lesion, ipsilateral half of the facial paralysis. We have seen that in our second slide. Okay, that's all. Now we'll go to the second slide a little bit. Okay, so here is the upper motor neuron up to this, then lower motor neuron. Here upper motor neuron is, this is upper motor neuron. Then here we have the, this is the lower motor neuron. Here it will start from the medulla oblongata to the effector organ. Okay, this is lower motor neuron lesion. So it may be lesion here, lesion here. So in lower motor neuron lesion, in facial nerve, we'll have entire side will be, if we have lower motor neuron lesion here, then entire side will be paralyzed. In case of supranuclear lesion, only the lower 2/3 will be paralyzed, upper 1/3 will be sparing, this part will be sparing. Okay, so we got that. We have gone through the characteristic of the upper motor neuron lesion and lower motor neuron lesion. Okay, so we got the note that this is amyotrophic lateral sclerosis is a disease of both upper motor neuron, lower motor neuron. Polymyalgia is disease of the lower motor neuron, especially the anterior gray horn neuron. Facial nerve palsy, upper motor neuron lesion, contralateral lower 2/3 of the face paralysis. Lower motor neuron lesion, ipsilateral half of the facial paralysis. And that's all about today's topic. Okay, we have gone through upper motor neuron lesion, lower motor neuron lesion, location of upper motor neuron, location of lower motor neuron. So if you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me and have a nice day. Bye now.